Hey, it's Dr. Collins, and I just wanted to take a minute and go over kind of the technical side of the Dieffenbachs. Many of you saw the video that's been floating around the last couple of weeks. We did an episode on their whole family being under care and a lot of the things that they were experiencing that brought them in. So the Dieffenbach story in this office started with my wife and I, Jacqueline, going to Abundant Life, which is Tammy's birth center, to get set up to have our baby naturally, little baby Ella. And through the course of that 9 months, we were talking about upper cervical and atlas care. Tammy and her family have been under chiropractic care. Obviously, they're natural and trying to do things from a wellness standpoint. They've been under chiropractic care for years. So she was very intrigued by getting the atlas checked and what that could potentially do, because her family was experiencing a lot of different symptoms, and regular chiropractic care was not able to resolve those. So starting with Andrea, she was having really bad low back pain. She came into the office and has been doing so much better. Rachel was having low back pain and seizures, which has resolved, and she's doing so much better now. Luke was experiencing Tourettes and has noticed a marked decrease in the tics that he will have. Tammy herself was experiencing Raynaud's, and you know how moms are, they put themselves sort of on the back burner, take care of the kids first. This was the case with her, but it was amazing once we adjusted her atlas that she was experiencing a decrease in the inflammation in the joints of her hands. I don't even have a good explanation for why that was the case, but when you correct the atlas, really amazing things can happen with somebody's body. So when we're talking about things like low back pain and neck pain, in previous videos you've heard me talk about how when the atlas is off axis underneath the skull, it will come with a certain amount of head tilt because of the shape of the joint. What the body will do to try to mitigate that neurologically is tighten up in the low back and in the lower neck to create a new eyes level posture. And until that head and neck is properly released and allowed to basically find the new normal again where things are balanced posturally, there's going to be a certain amount of neck pain in the muscles, over time disc and nerve problems, and not only in the neck and the low back as well. Andrea is your textbook atlas out of alignment, body twisting and compensating to keep the eyes level, low back and a lot of pulling pain and a lot of pressure building up. She is a CrossFitter and is actively working in preparation for a future as a firefighter. So when she came in, there was a lot of twisting and, like I said, compensation and pain. Releasing that atlas and getting things properly aligned allowed the body to have eyes level without having to contort and twist to do it. So that was huge for her, having a reduction in pain as well. Rachel is the sweetest little girl in the whole wide world. She was experiencing low back pain, seizures at one point, but what I found interesting with Rachel's case is that just about every day she was going to her mom. This is what Tammy reported, and she was saying that she needed to be adjusted. Always felt like her back needed to be adjusted. And with restoring the atlas alignment for her, her back was able to release, and she doesn't have that chronic nagging need to go have her back cracked and adjusted. Luke is a great example with what happened with him of releasing neurologic tension at that upper neck and seeing a result in a reduction of neurologic symptoms. So in the same way that Rachel, maybe somebody like Rachel will say that was having seizures, or Luke with Tourette's, whenever you have compression at the base of the skull, that's your brainstem. That's all of the nerves that are leaving the skull. They're also the nerves that are feeding the head, face, and neck. If you irritate this area, there is the possibility that you could experience neurologic symptoms. So the next step would be reducing misalignment in this area, taking pressure off of those nerves. Could see a reduction in neurologic type symptoms. It is critical, okay? I can't make this point strongly enough. It is not being adjusted that has people doing better from neurologic symptoms. It is holding proper alignment and not having pressure on that area that allows you to have a more normal experience in your body and not be experiencing at least the same intensity of neurologic symptoms, which is kind of a scary situation when being Tammy and you have children and you're trying to do things naturally and avoid the common sort of path of putting your kids on prescription meds, potentially looking at some sort of surgical intervention or something that's more invasive it's a scary thing. What do you do, right? In my opinion, the first thing you should do is get your neck checked, because there's so much neurology and blood flow and things going on at the base of the skull there. If you are experiencing any of these kind of things, and Tammy's case is a great segue as well. She was experiencing really severe inflammation and Raynaud syndrome, where you lose the color in your hands. It can be related to temperature. It's a neurologic, autoimmune type condition. Well, releasing her atlas and keeping her in alignment has allowed her to have less inflammation in her hands, to allow that Raynaud's to come down and that autoimmune and neurologic bad behavior to cool off. You know, what are these solutions for people who are experiencing things like that? So it can often sound cheesy to list all of these different symptoms and say that upper cervical care is the cure for all of these things. A better way to approach it is actually, when this area is off, because it's your brainstem, the arteries and veins that are feeding the skull, and because the posture has to accommodate for that head and neck being off, there's a lot of things that can go wrong with a body over time when that area is off and there's compression or irritation there. Restoring proper alignment underneath the skull, getting the pressure to release, opening up blood flow, taking pressure off the nerves, there's a lot of good things that can come out of that from a health standpoint with a body, and a lot of symptoms that can resolve. So in terms of adjusting harbor, I think this was an interesting, worth talking about with people. They wonder, can you x-ray, are you gonna do the sound wave on a baby, right? Because this is kind of a controversial thing, x-raying babies. No, you don't have to necessarily x-ray an infant or a small child that's a year or 2 years old. You can actually do what's called an atlas challenge, where you very lightly put pressure on either side where the atlas transverse process is, and very lightly influence it one way and then the other, and then watch the body respond. Typically in a small child like that, the low back is even more than the legs being off, because the body's twisted. The low back will show an asymmetric pull on one side. So just brushing on that side of Harbor's neck allowed her body to open up, pointing to the side that I needed to adjust. If I was to brush the other side, things would tighten back up as it was irritated. So I knew where I needed to adjust. In terms of actually correcting her neck, we don't have to set her up on the sound wave either. I've adjusted babies as old as a day old now with mine. You can very lightly either palpate and adjust with just a little bit of pressure touching, or in Harbor's case, actually setting her up on the headpiece, because she is very cooperative, and using a handheld instrument to actually release on a specified angle that joint. And so without having to, take x-rays or do something that's more invasive with an infant, you can get them adjusted and have that joint release in a specific way. So Tammy and I have talked, and now that we've kind of been through this with her family, she is amazed that she hadn't heard of this sooner, which is why I'm taking the time to do this video, to make you guys aware that this kind of care can even help these sorts of issues. So we're going to be doing these monthly, where we highlight somebody's story and some of the conditions that can resolve with this care, and then me later going into a little more of the technical aspects so you guys understand how it works and how it can help you. Thank you guys for watching this video. I hope you found it helpful, useful, informative with how upper cervical care can improve some of the symptoms associated with things like seizures, Tourettes, Raynaud syndrome, low back pain, neck pain, and a lot of other neurologic and musculoskeletal conditions. So I would love to hear from you guys. I'm doing this video to try to spread awareness about this kind of care, so I don't have to walk into your small business and talk to you before you even know it exists. So I'd love to get a Facebook message from you guys, or an email if you go to our site and fill out the form on there. We do a Dinner with a Doc workshop. We'll have one of those coming up in the near future. Reach out to me and let me know what's going on with you, and see if potentially you could get some relief from the realignment of your atlas and keeping that in alignment over time. So thank you guys for watching this, and God bless.